Hi, everyone. Thank you for joining us today. We're going to get started. I just want to introduce myself. I'm Kimberly Weiland. I am a Senior Client Experience Manager here at Cognito. I'll be your moderator today. We're going to talk a little bit about some of the mandates that are happening in states across the country and how school districts and states are really meeting those mandates within their states. So we're going to start today by going over some of our housekeeping, and then I will introduce our speakers. The presentation today will be recorded. You will get a copy of the recording sent to you after this presentation. For our presentation today, you're going to be in listen-only mode. If you have any questions, you do not need to unmute. You can go to the right side of your screen and you can type the questions into the question box that is highlighted there on our example for you. And we encourage you to connect with us as well. Follow us on Twitter. We do quite a few of these types of webinars, which have great thought leadership speakers from across the country. So I really encourage you to follow us. So let's get straight to our speakers today. We're really excited to have both of these speakers. Linda Diaz is a youth mental health advocate in the state of Maryland. I'm going to let her give a little bit more background when we move to her slides and a little bit about her story. And then we have Carrie Ann Pert, who is working as a health education manager within the Department of Education in DC, and specifically in the Division of Health and Wellness. And her team has really been tasked with meeting the mandate there in DC. So I'm going to turn it over to Linda. Very excited about today's presentation. Thanks so much.
Hello, and thank you for having me. My name is Linda Diaz, and I am a youth mental health advocate in the state of Maryland. To give you a little background on how I began this journey, in 2013, I lost my 15-year-old daughter 3 weeks after her birthday to suicide. Because of the ordeal and the trauma of losing my daughter, and seeing the ripple effect of suicide and the nature that it took with her friends and family members and how it affected so many individuals, I realized that I had never truly been educated, nor did I ever know that mental illness was not just a disease, but it does take its toll on individuals because we are not aware. We don't have the information. We are not clinicians to be able to understand the mental health and well-being of our children. And the slides that you're going to see today is going to give you a very small look into the journey that it took in order to have two laws in the state of Maryland created and approved by the governor and put into legislation. The laws are named after my daughter, and it began on, I want to say July of 2014. I had been going through a lot with regards to trying to work with the school systems to get a lot of help for individuals that were reaching out to me that were being affected by my daughter's suicide. When I realized that I could not get the help from the school that my daughter attended, the local board from where my daughter attended, I decided that I could not allow any more children to continue suffering from being blinded or not having the education to understand what they can do and that there was help out there. So what I did was I went to Annapolis and I researched individuals, our state legislators, our representatives, and did a background search on the ones that I thought that I could reach out to to see what, if anything, could be done in order to help our children and to get them the assistance that they needed in the schools. When we began this journey, what we found out was that the Maryland State Department of Education had not required that school counselors be certified. They did not have to recertify, nor did they have to take continuing education credit to maintain a special title of school counselor in youth behavioral wellness substance abuse. So with that said, the first law was created, which was House Bill 947. The blueback from that House bill, once it was created, had to come back, and once the approval of that blueback was returned, we then had to lobby through legislation to receive sponsors in order to be able to educate or attempt to educate the school system with regards to how important it was for the school counselors to be able to understand how important our children were. And when we were going through with House Bill 947, after the approval process, after Governor Hogan had signed it into law, in working with the Maryland State Department of Education, we joined forces. And what we did was we created Lorenz Law Version 2, which was House Bill 920. And House Bill 920, what we realized in going through legislation with House Bill 947 is that we could not allow the weight of our children to fall solely on the school counselors, because not each school was the same. There was a higher ratio of more students to counselors in different schools. So, for example, one counselor had 900 students in one school. And we realized, well, we just can't do that to counselors. So what we did in working with the Maryland State Department of Education as well as Cognito and other organizations, we came up with House Bill 920, but we needed to make sure we provided the availability for everyone, all school personnel, staff, faculty members, administrators, to be able to go in every year and have refresher or suicide, behavioral wellness, substance abuse programs available to them on an annual basis. And when we were successful in being able to lobby these bills and receiving the sponsors and testifying in front of legislation for each of these bills, we were able to get both of these bills signed into law. The next slide you're going to see is an example of what the bills look like. You're going to see that although we have provided this in a small version, there's a lot of work that was placed into having these laws to come to fruition, to be able to be approved. The process is so long and very detailed that. Can you hear me? The process is so long that.
We can hear you,
Can
Linda.
you hear me okay? Okay, thank you.
We can.
Thank you. We needed to make sure that everyone was educated. So we were absolutely educating everyone along with us. So with legislation, we were providing them all of the information. We had to provide them with fiscal analysis of what it could possibly take in order to be able to have these laws and to make sure that we uphold all of the work that we have done. And as you can see, the process of providing these analysis and going back and forth with legislation as well as the ACLU and many other organizations, we were able to go through both houses, the House of Delegates as well as the Senate, 100% unanimously sponsored. Every representative and every legislator representing each county in the state of Maryland was very happy to support these bills in order to be able to move forward. And on the next slide, you're going to see the votes and the hard work that it took in order to be able to pass this. And although you do see the unanimous votes on both of these legislations, what you're going to see at the bottom is that unless the governor approves the legislation, it is not put into law. It is not passed forward and approved and signed into law. So we were very happy to see that the governor really supported us and knew that in order to create a better tomorrow for our youth in the state of Maryland, he signed both of these laws into legislation. And ever since then, we have been doing nothing but sharing this information in order to see what we can do across the board and have all the states to be able to have legislation like this in order to be able to give our children the right to understand that they have a voice and that legislation is there to make sure that they do have a better tomorrow. And with that, I want to close, and I want to say thank you again for having me. And if there is anything that I can do to assist or answer any questions, please let me know.
Linda, thank you so much. And I just want to say for everybody on the call, Linda is so passionate about this, and she has remained very active. So at the end, if you have any questions, please put them in, and she's more than happy to answer. She's also been involved in seeing how this legislation has been taken in by the DOE and turned into the actual regulations for and recommendations for the state school districts. So we can also answer any questions about that as well. And thank you so much, Linda. We're going to talk a little bit now about what does that look like once the law is passed and that has to be turned into a specific program to roll out. What does that look like? And Carrie Ann and her team just did that in DC, and so I want to turn it over to you to talk a little bit about that experience.
Sure. Thank you, Kim. And thank you, Linda, for the opening presentation. That was very powerful. And thank you for your work in the field. It's so very necessary. So hi, everybody. My name is Carrie Ann Peart, and as Kim said earlier, I currently serve as the Health Education Manager for the State Education Agency here in DC, otherwise known as the Office of State Superintendent of Education. My portfolio is a comprehensive one, so I deal with managing the implementation and evaluation of health programs delivered both in the public and charter school spaces here in the district. And of course, it encompasses a lot to do with mental health service provision as well as program implementation. So kicking things off, I just wanted to introduce you to two of our policy pieces that our agency really helps to push forward and help orient our stakeholders to. And the first one is our South Capitol Street Memorial Act of 2012. This act was actually birthed out of a very horrific incident that occurred in the district 2 years prior, where we found some violence happening among some young people, and tragically 4 were killed and 6 were horrifically injured. And this raised alarms, of course, because issues around youth violence, along with attention being raised around youth behavior management, um, was finally kind of the bells were ringing based on this incident. And so action was taken and a movement was spurred, and this particular act was put in place by 2012. The other policy piece that was put in motion was our Youth Suicide Prevention and School Climate Survey Amendment Act of 2016. Between 2014 and 2016, of course, a lot of observation around youth mental health services and practice in the district took place, and more incidents around youth behavior issues and increased incidents around youth suicide came up. And so, of course, further action was spurred. And at that time, the mayor that was in office, Mayor Bowser, put in place this particular act. So as of October 1st, the law is in place and it requires that teachers and principals across the district are educated and empowered to recognize signs and symptoms of youth in crisis and to be able to act accordingly in measures of prevention as it pertains to suicide, and for those incidents that do occur, how do we address postvention mechanisms within our schools and across our school staff? So moving forward from these policy pieces, we, of course, had to build coalitions, essentially. And what we found is that our Department of Behavioral Health, which has a specific segment that addresses mental health in schools, has put it out that at least 30% or roughly 30% of schools within a district only those 30% have mental health services available currently to students. That's roughly 30% of those schools, which is very low. So given the shortage, the Department of Behavioral Health and DC Health, which was formerly our DC Department of Health, partnered in 2016 to expand these services in schools for students and focused on the expansion mechanisms taking place for the school year, of 2017 to 2018. So the expanded effort garnered a lot of support from our mayor, and it increased attention on the matter of the importance of students being mentally safe and supported, especially as it relates to their academic success and positive development. And with the expansion activities taking place, the mayor's attention on developing a task force was a coordinated effort, and that came about. And this particular task force evolved and became the Coordinating Council on School Mental Health. This particular council is made up of several community members that range from parents, young people themselves, other advocates, and we all meet together to make sure that we are developing strategies and best practice measures to really forge forward mental health services in the schools. As part of the large expansion effort, Cognito came into play, and with their relationship with our Department of Behavioral Health. And the training platform was promoted as the essential component necessary to implement the Youth Suicide Prevention and School Climate Survey Amendment Act, which I mentioned previously. And this uptick in 2017 to 2018 school year, DC saw the largest number of engagements or activations, as Cognito calls them, over that school year, of over 6,000 principals and teachers being involved with being informed and educated by the education tools. So moving forward with that, the coordination efforts were ramped up, as we can imagine, with Cognito, along with the partnership with the Department of Behavioral Health, and then pulling us on board as the state education agency. And this helped to really increase access to schools, since we, as a state education agency, work with schools on a daily basis. And with the role of OSSE, this helped kind of form more of a coordinated effort to really gain support for the expanded focus on school-based mental health services. And so the coordination efforts really supported the policy pieces that we had been trying to hold schools um, accountable for. And so this took, of course, significant outreach to both public and charter school principals and staff. And this was accomplished by drafting a memo that really highlighted the legislation that is in place, the addressing school suicide and prevention mechanisms, as well as indicating that Cognito is the necessary tool and platform to use for training and to be compliant with the policy structures in place. So as you can imagine, it's all well and good to have policies in place and have an implementation plan, and then when you roll things out, you have a few challenges. And at the time, we faced some pushback from schools based on some competing priorities that schools mentioned. And so that was a major hurdle when it came to timely completion of the required training mechanisms. This, of course, gave us another opportunity to really strategize around outreach mechanisms with our school staff and principals, and to really hone in the value of increased awareness, but also being able to have tools in place to recognize, again, signs and symptoms of young people in distress. And so OSCE and DBH is our Department of Behavioral Health, developed communication to support the requirements of the policy, and really worked with schools to help accomplish alignment by having staff complete the training as a portion of their professional development. So really taking a step back and seeing the policy and training mechanism as an opportunity to build staff capacity and knowledge to address the situations that we're seeing across the district. So again, our communication highlighted the importance of student mental health and how important and critical wellness is to academic performance, and the fact that our teachers and school staff are often vital lines of defense when it comes to suicide prevention and mental health safety of our students in the schools. So that was our trajectory. And if anyone has any questions, I look forward to answering them. Thank you, Kim.
Thank you so much. If you have any questions, please send them in. Some people sent them ahead of time, and I have one or two that I wrote down as you guys were going through that I'd love to talk about. But let's start with some of the ones that we have gotten in the past. And I want to start with the idea that both of you said one of the things that you needed to do was expand beyond the counselors and build capacity quickly across the teachers and other staff in the school. One of the questions is, what is the role of teachers and staff, and what is the training that you guys are providing that to them? How is that differentiated from what the role of the counselor in the school is? And I don't know if Carrie Ann, if you want to take that.
Sure, I can take a stab. So one of the things that we've observed a lot of times is that there's a lack of capacity in terms of how many counselors there are per number of students in our schools. And so the caseload of counselors is overwhelming. And that was one of the things that was raised during this school-based mental health expansion effort in the district. And our Department of Behavioral Health has really made it a priority to increase the number of counselors available in our schools, but also recognize that students have significantly positive relationships with their teachers and other members of school staff. And so disclosure of certain stressors or just observations of students' behaviors may happen first in front of teachers, or maybe disclosed first to teachers or other school staff. And so equipping them to respond in a positive way was made a priority across our schools. So it's yes, we acknowledge the fact that our counselors are very necessary and we want more of them in schools, but we also need to help their capacity by strengthening teachers' abilities to serve our students in a more comprehensive manner, given the relationships that we know students have with their teachers as well.
Thank you so much. And Linda, did you have anything you wanted to add?
Sure. Thank you, Carrie Ann. Thank you for all the work that you do. It's amazing, and I'm greatly appreciative for you. With regards to Lorenz laws and how we made sure that we worked with the school systems and the Maryland State Department of Education, we thought that it was very important that when children are going through their day-to-day activities, they're often in front of their teachers. They're not necessarily going to be in front of their counselors. And instead of, waiting for the child to be in crisis, that is how, we came up with helping the counselors, because even though the counselors have more of the training and they will have more of the background and working with the school assigned psychologists in order to be able to help our children, we wanted to make sure that the front line was also equipped with the availability, the training, and the programs in order to be able to see the signs in the children. And who better than everyone else, the school nurse or the teachers that these children interact with on a daily basis? They will be able to see the signs, and that in turn assists the school counselors, because as Carrie Ann stated, and through Lorenz Law version 1, the ratio of students to counselors was overwhelming, and it's not fair. I know myself, my daughter was never able to see her counselor, and I ended up losing her. But that is not the school counselor's fault that I lost my daughter. It was just a lack of knowledge and understanding of mental health and how risk factors in life can cause trauma to children. So that is how the ratio of having the teachers on the front line or other faculty members and administrators who also see these children, they could provide the assistance for the school counselors to go through their checklist and their protocol and work from there and be able to get to a point where this child needs help. Let's reach out to the mom, the dad, the caregiver, and let's work together to get this child the help that they need.
Thank you, Linda. And that's such a good point as well. I know that DC, as part of their piece, they use the at-risk simulations from Cognito. They've also created a referral piece that goes with that actually goes through the referral process. So teachers are very aware of what that is to be able to make sure that they're making those warm handoffs. So a really important point. One of the other things that was mentioned is the barriers that you guys had faced. Carrie Ann, you specifically mentioned the communication because schools have other priorities, and how do you get them to really want to do this? But those barriers can be significant if the mandate isn't clear, and so that is a question that we've seen come up a couple of times. Do you want to just talk a little bit more in depth about how you overcame that barrier?
Sure. So I will have to say that I wish my colleague Kyle was on the call as well, but he's occupied today. Is another meeting. He is our policy guru here on my team, and so he and I had discussed a lot of the challenges that he faces on a daily basis when it comes to other policy implementation and education aspects. And one of the things that we're recognizing when it comes to overcoming these particular pushback points is that a lot of people, particularly in the education space, when we're asking teachers consistently for a lot of things, is that they don't feel involved in the process of the development of the policy. So whereas we do have, stakeholder engagement and we brainstorm around ideas and put things together in order to construct policy, a lot of people are not necessarily communicating that process broad enough to have people buy in early. And then when the policies are passed and then implementation mechanisms are being put together, we still sometimes don't give enough time to incorporate the voice of many stakeholders. And so when it gets to this pushback point, it is, just being able to take the time and saying, okay, well, this policy was birthed out of A, B, C, and D. This is how it's going to be rolled out. What are your takes on the rollout of it? What is the timeline that you are already operating up against? And how can we work within your timeline structures? What other buy-in opportunities could we possibly develop for you? And so that was one of the resolutions we came to here in DC, is that the professional development opportunities for our teachers is a great space to reintegrate folks when it comes to policy pieces, and then to roll out actual implementation tools such as the Cognito training platform, and to really have teachers and other school staff and youth professionals in this space really recognize that these things are in place for the well-being of our young people and the safety of our communities. And as rushed as things may feel for some people, it is a priority. And we do want their voices to be consistently heard. And it's just a matter of how we develop processes to be a lot more iterative when it comes to pushing policies and implementing them and coming up against these roadblocks and really respecting the roadblocks, and then moving forward from there with more stakeholder engagement as best as possible. So that's what we have had to kind of grapple with over the past year and a half, is to really re-engage our stakeholders and the landscape that they operate in daily, and to figure out how best to align and complement the work.
Thank you. We do have quite a few counselors on today, and one of the questions that does come up for them is that they only get so much time in their schedule for mental health counseling. There's a lot of other priorities on their plate. Their question is, are we looking at any legislation that clears some of the clerical stuff off their plates and gives them more time for mental health? You guys might not be able to answer that one, but it is one we hear a lot from counseling staff. So that is probably one that is we're not able to answer today, but it's definitely, I know, a pain point. And part of the reason I know that both of you mentioned why really trying to make sure that there are more school counselors where that's possible, as well as making sure that you have your gatekeeper training for more staff in the school. There's always the question that comes up about funding, and when legislation comes down, where the funding comes from to be able to meet that. Is that a question that you guys are able to answer?
This is Carrie Ann. I can briefly do something, but I let Linda go first. Please, Linda, go ahead.
Oh, thank you, Carrie Ann. What I was going to say was, in working with Annapolis here in Maryland with regards to legislation, what we did is we absolutely looked at the funding with regards to having Lorenz Law version 2 completed, and that is where partnering with the organizations such as Cognito and using their platform, that was the most amazing, part of the legislation that the Maryland State Department of Education just thought was wonderful. And the funding was not required because of Cognito and the partnership with SAMHSA and utilizing the grants in order to be able to provide programming to all of the facilities, the schools, the administrators, the teachers, everyone. Now, the only thing that the school counselors needed to do was, and this was something that's a part of the requirement of holding the special title of counselor, is they just had to pay for the continuing education credits and in order to recertify and continue with their license and special title of school counselors. But I know that last year I was able to work with the Maryland State Department of Education. My goal is to help the state in not having to fall under when it comes to funding, because I don't think that the schools should be held responsible for creating programs and finding these programs in order to enrich the lives of everyone. We need our teachers and our counselors and administrators to be happy because they are working in a sanctuary to provide knowledge to our youth, and our youth are our future. And so in working with the Maryland State Department of Education last year, they were able to get a huge, substantial amount with regards to large grants in the millions of dollars in order to be able to create more safety programs and behavioral wellness programs for the state of Maryland. So I like to work with the state one-on-one in order to help them, not cripple them. And that's what I do in Maryland on our side. Carrie Ann, how about you?
It is fantastic to hear when people say that their states fund them, and I keep thinking to myself, DC is never going to be a state. But similarly, our agency works in kind of a parallel to what you're describing, Linda, that we are able to draw on opportunities that are offered nationally for grant funding, and we have been able to tackle those opportunities to the benefit of our community. Of course, they're hard to get, they're hard to maintain, and a lot of times, you know how it goes. You get these grants, they do the work for a period of time, but then people don't see the impact as quickly as they would like, and so the competition builds up again to maintain the grant moving forward. And so our strategy has really been not just looking for grant opportunities, but really working with our council members here on local government and our mayor's office to really illustrate the need and the priority for the safety and wellness of our young people. And so Mayor Bowser has been amazing with contributing several layers of funds to really push forward the expansion of school-based services regarding mental health and safety for our students, and working in partnership with other DC agencies such as our Department of Behavioral Health and DC Health has also helped us to really look at funding strategies in a more integrated manner, and to make sure that we're really using the dollar wisely to expand services and to improve the quality and strength of services, which is also a priority for us as well. So it's all well and good to have the money, but is it really boosting what you currently have in play and innovating moving forward? So that's kind of our two-pronged approach is really tackling what's on the national landscape for grant opportunities, and then to work locally to really gain buy-in from some of the local funding strategies we already have available to us here. And so we've been successful thus far and really hope to continue pushing forward. Our most recent success was the win of our Project Aware grant, which I think most people may be familiar with from SAMHSA. And so that is really going to help us to move this expansion effort forward in a more aggressive and intentional manner. And so we're really excited about the plans that we have for this year to really get things going. So we're doing it similar to states, even though we may never become a state. We're still trying to play on that level of the playing field.
As somebody who lived in DC for 10 years, I I like that comment.
Thank you.
One one of the things that has been asked is, how are you guys evaluating the success of this legislation and the training that you have rolled out?
Well, I can answer that in a very positive way by saying that I didn't just work with legislation. I physically still go out. I advocate. I speak. I don't charge any facilities, schools, communities, um, any fees, expenses uh, to speak, attend events in order to spread community awareness. So I don't rely just on legislation and the schools. They need our help to be able to show that if we work together, this is what we can do and this is what we can accomplish. And going out into the community and sharing Lorenz Law and spreading awareness and assisting and educating and providing community members, especially underserved communities, the availability to know that these resources, these programs are out here to help them. That is what has been helping Lorenz Law to just skyrocket. We have three different locations. There are two colleges. There's Goucher College and Loyola College that have both picked up to assist the state of Maryland in acquiring their certifications and to meet their requirements of Lorenz Law by providing the actual courses. So they developed courses specifically following the requirements of Lorenz Law in order to ensure that the school counselors and anyone else who wants to receive the continuing education credits with regards to Lorenz Law, they are all receiving these courses. So this is out there, and I believe it is a lot. It has a lot to do with the passion that comes behind it, and youth mental health is extremely important to me, not just because I lost my child, but everyone should know that every one suicide can affect nothing less than 120 people, and that extended far past that number when it came to Loren. Losing her affected not just children, but many adults, to the point where it's, it causes them not to be able to even speak or say her name. And what I want to do is prevent that. I'm sure that's my vision. My vision is zero suicide. And I'll probably die before that comes, to fruition. However, I will do what I can to make sure that I can help and spread legislation and help save lives as much as I can.
So to that training, capacity building type of query, our agency, as a state education agency, you can imagine, has a lot of divisions that do extensive levels of work. And one of our divisions actually has a training component that deals with expanding knowledge and toolkits around trauma informed practices. And that is something that, um, as a district, we've really honed in on heavily. I know several years ago the work was prioritized by our Child and Family Agency, CFSA, and since then, in partnership again with the Department of Behavioral Health and DC Health, a lot of the efforts when it comes to training our youth service providers on a whole, not just teachers, but anyone who's coming in contact with a young person is made aware of trauma-informed approaches and practices. And so that is ramping up again now that we've had a new set of funding mechanisms coming in, and a new set of, or I guess a new set of eyes or a new level of attention to the policies that have been in place, to really think about how we can ramp up trainings around trauma-informed approaches and what that means for the body of work that has already been in existence and what it means for innovating moving forward. Um, Linda mentioned youth mental health, and I thought immediately about youth mental health first aid training, which is something that is very near and dear to my heart personally. But that's also another avenue of training that has been revisited in the district. And so looking at how we can have parents involved in being trained on that particular platform as well. So there are several kind of avenues that we're reinvesting in and really hoping to push forward as best as possible in terms of training and developing skills.
Thank you so much. We don't have any more questions, so I'm going to go ahead and close the webinar for today. But I just want to say thank you again. And Linda, your point that this work is about saving lives is the most powerful in what it comes down to. So I just want to say thank you again. And if anybody has any other questions for our presenters, you can send them in. We'll work with them to get this presentation and any other questions back out to the group. And thank you again, Linda and Carrie Ann. Hope you both have a great rest of your day.
Thank you. Same to you.
Thank you. Same to you.